Hi everyone, I wanted to make a video about abs today. That's a topic I get asked a lot about. Usually it's in the form of what exercise can I do to get rid of this, or what can I do to, get a six-pack or something like that. And I just want to make it very clear that when it comes to abs, you're not going to get a six-pack from any exercises. Visible abs come from a low body fat. So that's going to be all diet and some genetics as well. So different people see abs at different points depending how you carry your body fat in proportion to your own body. For me, I lean out from the top down. So I'm going to see my arms get cut and my abs get cut way before I see my legs get cut. Other people, they can lean out from the outside in, so they might see their limbs, legs and arms get really lean before they ever see any kind of definition in their midsection. So there's great variation among individuals. And when it comes to seeing abs, that's diet. So don't look to exercises for that. That's not to say that exercises aren't important. It's very important to train your core. It's very important to have a strong core for all your daily activities. It's your base for the movements of your body. So you want to make sure that you do it correctly. For me, I've had 2 kids. I also had a hernia surgery, so there was a point where I had basically zero core strength and I had to rebuild from the top, or from the bottom up. So for me, this was a really important exercise that I think gets neglected a lot. It's for the transverse abdominus. So that's the deepest layer of all the abdominals. So when we train this one, it's not that we're going to train it with any kind of crunch or lifting action. We're actually training activation. So this one, I'm going to talk about it before I do it. This is going to have me on my back, knees up, feet flat on the floor. I'm going to support my head with a foam roller. I'm also going to have a blanket that I'm squeezing in between my knees. And I'm going to have an object. For me, I'm using a Bath & Body Works candle. But any kind of object so that you can visibly see the object dropping. That's what you're going to need for this one. So I'm going to do abdominal vacuums. And I'm going to continue breathing normally, and while I'm squeezing the blanket between my knees, I'm going to place the candle in between my hip bones on my stomach, and I want to activate and kind of vacuum my abs so that the candle drops down. I want to make sure I'm not pushing my abs out or pushing the candle up, and I don't want to do any kind of crunching motion or holding my breath while I do it. So I'm going to do 3 sets for 5 seconds just to demonstrate what it looks like, and notice that you're not seeing the candle push up unless I'm releasing. So I'll go through when I do that so that you can see what I'm doing. But I'm going to support my head. Let's get in my frame here. And then I have this blanket. It's just a soft blanket, but it's going to be between my legs so I can squeeze it in. Then show these abs here, or soft abs, and I'm going to place that there. Okay, so this is just normal. I'm not engaging anything, and so when I engage, you're going to see it drop down, and I'm just going to continue my breathing normally. I'm not going to talk, but I'm not going to do any sitting up or anything like that. Okay, so watch for that, and while I do it, I'm also squeezing my legs together because I'm trying to vacuum it in. Okay, so watch. That probably wasn't a full 5 seconds. But I'm also having the feeling like I'm pulling my belly button down through my spine. So I'll do it again. Okay, so did you see that one? And I'll do it one more time. There. So it's quite subtle. It's not that much of a drop, but the main thing that you want to do is make sure that you're not pushing it up, because that would be incorrect. You want to feel that you're vacuuming the abs down, because that's going to strengthen the muscles that are very close to the spine that support the back, and that will improve posture, prevent low back pain, stuff like that. That's quite important for overall health. I'm also going to post a few links about the transverse abdominus, so please take a look and please see if it works for you to incorporate this into your routine at all.